Hello, everyone. Welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for October 17, 2018. Thank you for joining our presentation this month. Our presenter today is Lesha Spencer-Brown. She is a Health and Wellness Program Manager at the National Recreation and Parks Association, NRPA, working to improve the health and wellness of older adults through parks and recreation. She currently manages NRPA's Healthy Aging in Parks initiative that aims to improve and maintain the health and well-being of older adults through parks and recreation. Lesha received her Master's of Public Health and Community and Family Health Social Health Sciences from the University of South Florida and has over 8 years of experience in the field of public health, specifically in health promotion, disease prevention, and social determinants of health. Prior to working at NRPA, Lesha served as a community health worker program coordinator, working to improve coordination for individuals affected by chronic diseases. Welcome, Lesha.
Thank you, Haley. And hello, everyone. Thank you for joining us today for this webinar, Parks and Recreation, Implementing and Sustaining Arthritis-Appropriate Evidence-Based Interventions Across the Country. As Haley mentioned, my name is Lesha Spencer-Brown, and I'm a Health and Wellness Program Manager at the National Recreation and Parks Association, NRPA. So in 2013, NRPA began working with the Arthritis Foundation and the National Association of Chronic Disease Directors to disseminate the Walk with Ease and Active Living Everyday programs. In 2016, we were one of 4 recipients of a 5-year grant from the Centers for Disease Control and Prevention, charged with increasing the availability, participation in, and sustainability of arthritis-appropriate evidence-based interventions in efforts to improve self-management skills and the quality of life for individuals living with arthritis and arthritis comorbidities. So before I talk about the delivery of these programs through Parks and Recreation, I would like to give you a bit of a background about NRPA. NRPA is a national nonprofit dedicated to improving the health of communities through parks, recreation, and conservation. We work on behalf of more than 12,000 local park and recreation agencies. So these can be city, town, local municipalities, tribal or special park districts, and more than 60,000 park and recreation professionals. Our mission is being accomplished through 3 main pillars: health and wellness, looking at improved health and wellness initiatives and programming through parks and recreation; conservation, so looking at those initiatives and programming that protects open spaces, connects people to nature, and engage communities in conservation practices; and the cross-cutting social equity to ensure that all people have access to the benefits of local parks and recreation. As I mentioned before, our goal through our CDC grant is to expand the dissemination and delivery of arthritis-appropriate evidence-based interventions through local park and recreation agencies. This work is a component of our Healthy Aging in Parks initiative, which aims to improve and maintain the health and well-being of older adults. We fielded a survey last year, and that survey found that 9 in 10 local park and recreation agencies offer programs and services for older adults, 76% of which offer evidence-based programs. A majority of which targets falls prevention, diabetes, and arthritis. And this initiative, Healthy Aging in Parks, really helps local agencies to further the work that's already being done in light of the fact that the aging population is rapidly growing. We want to better help our agencies so that they are prepared to serve the unique needs and desires of the aging population. So this initiative has 3 main strategies: chronic disease prevention and management, food security, and social connectedness. And today I'll be talking to you specifically about our chronic disease prevention and management strategy. So our chronic disease prevention and management strategy as it relates to arthritis management in parks and recreation aims to, one, increase the availability of arthritis-appropriate evidence-based interventions, which I'll refer to as AAEBIs. And we're doing this by offering AEBI instructor trainings to park and recreation staff across the country. Two, we are aiming to increase the number of adults enrolling in AEBIs. And we're doing this by providing technical assistance and resources to our agencies in order to assist them with marketing, recruiting, and retaining adults that would benefit from these programs that are being offered. And three, we're looking to establish permanent systems of referrals through clinical community linkages that really enhance the coordination among healthcare delivery and community-based activities that promote healthy behavior. And right now we're doing this by testing different referral models. Currently, we have a pilot in 2 sites, Westminster, Colorado, and Shreveport, Louisiana, to test the feasibility, effectiveness, and scalability of a referral process through the use of an electronic health record query. So this query essentially aims to identify patients with arthritis and then refer them to the AEBIs. And within this process, individuals with an arthritis diagnosis are pulled from the electronic health record. The healthcare staff then goes through this list to ensure that folks are appropriate for the programs. Folks might be deceased because the records aren't always updated, so they go through to make sure that the list is appropriate to be sent out. Then after they review that list, they send a letter to all of these individuals that have been identified. So if 500 individuals have been identified with arthritis and are deemed appropriate, they are then sent letters in the mail that talks about, the benefit that these programs could have for them, where the programs are being offered, times and date, and then who to contact. So within this process, this initial process, individuals don't necessarily have to be in the office in a clinical setting to know about the programs that are being offered at their local park and recreation agency. And we've had some success with this process. In one site specifically, over 400 individuals have already enrolled in an AEBI as a result of this process. And lastly, we are looking to establish financing options for participation in AEBIs, looking to perhaps include them as health and wellness benefits and health plans, and, to go along the route that's been done with the National Diabetes Prevention Program. We have not had significant success in this areas yet, but we are, continuing to look into ways to achieve this. But that's basically an overview of the objectives through arthritis dissemination, and how we are going to be achieving this and what we're going to be doing in the future, because we do have some areas to improve specifically with those financing options. So the CDC recommended programs being disseminated include 3 physical activity programs, and you'll see them here on your screen: Active Living Every Day, Fit and Strong, and Walk with Ease. I know many of you might be familiar with the Walk with Ease program because of the Osteoarthritis Action Alliance involvement in that, but we're also disseminating the Active Living Every Day and the Fit and Strong. And I'll just provide brief information about the Active Living Every Day and the Fit and Strong program. So the Active Living Every Day is a 12-week behavior change program, and it's tailored for sedentary people and teaches them the skills needed to become physically active. So there's no actual physical activity happening within the class period, but individuals really learn and talk through in a group setting, some of their barriers, how they can enlist social support, how they can set realistic goals for themselves, how to deal with lapses, and things like that. So they're really just setting themselves up for success once they do begin their journey to engaging in physical activity. These groups meet for 1 hour per week, so there's a total of 12 classes. The training for this program is online, and it's about 6 hours, and similar to the Walk with Ease program, this program does require a participant manual. So folks have, information to refer to once they've ended their class. The Fit and Strong program is a group exercise and behavior change program that's really designed for people with lower extremity stiffness, pain, and mobility challenges. It's offered in 2 different formats, and all classes are 90 minutes. So it can be 3 days per week for 8 weeks or 2 days per week for 12 weeks. And each class will consist of 60 minutes of physical activity and 30 minutes of group discussion health education. This training is also online, and it takes about 6 hours. And originally, prior to NRPA's dissemination of this program, the training was primarily in person, but we worked with the program developers at the University of Illinois at Chicago to test an online model, and then they went on to develop an online training curriculum. So this training is now, if you're previously aware of the Fit and Strong program and knew that it was an in-person training, there's also now an online curriculum available for folks who are interested in getting trained. This program also requires participant materials, including a participant manual, resistant bands, and adjustable ankle weights that are used throughout the 16-minute physical activity sessions. So this slide talks a little bit about the impact that agencies have had in delivering these programs. So to date, we have about 209 delivery partners. About 544 instructors have been trained across the country to deliver this program. We're currently in 48 states in American Samoa, so we're not currently in Wyoming or Delaware. Over 600 program sessions have been offered. So, and when we talk about session, we're talking about, the 6 weeks of Walk with Ease, the 8 or 12 weeks of Fit and Strong, and then the 12 weeks of Active Living Every Day. And these programs are being offered at over 360 program sites. And a lot of park and recreation agencies will have multiple sites just because, their service area might be large, and agencies can have upwards of 20 recreation centers. A lot of them manage and own senior centers as well. So they have a lot of spaces that they can actually offer the program. So, one agency could be offering the Fit and Strong program in 3 different sites. And then to date, we have reached nearly 14,000 participants. We're now in the process of collecting a new round of survey data. So the numbers here, particularly the number of sessions offered, the number of program sites, and of course the number of participants reached will increase. So on this map here, we can see where programs have been and are currently being delivered through Parks and Recreation. And the way we developed this map was to, overlay where programs are being offered as it relates to the prevalence of arthritis in certain states. So the darkest blue, which on this diagram here is West Virginia, you can see that we have, a few programs there, and then where it's very light blue, those states have less than 20% of arthritis prevalence. So here you can see where programs are in relation to prevalence of arthritis. We still have some work to do, but we are, looking to offer new training grants, which I'll talk about in a little bit, in order to enhance our dissemination efforts. So prior to actually scaling these programs, they were piloted in about 3 to 4 agencies, and we're looking to test or really to see if these programs are adaptable to a park and recreation setting. And so the different guides that you see here: arthritis intervention in parks and recreation, that's an active living everyday guide. We have empowering older adults to stay fit and strong, that is a fit and strong best practices guide. And then to your right, we have arthritis intervention in park and recreation settings, that is a guide regarding the Walk with Ease program. And these guides essentially provide an overview of how park and recreation setting agencies have planned, implemented, and sustained their programs. And so we use this, we have it on our website for park and recreation and non-park and recreation agencies to really look at and see how these programs have been implemented, and to really use this as a guide for how they intend to deliver these programs as well. And so I mentioned earlier a grant opportunity. And so we actually have 2. We're currently in grant year 3, so gearing up to, for a new round of grantees. And this first grant opportunity I will discuss is around those instructor trainings. And that's how we're essentially trying to increase the availability of the programs across the country. So this grant opportunity offers instructor trainings for park and recreation staff and their partners. We do have agencies who partner with their local Y, or other community-based organizations, even churches they partner with. So we'll have folks from other areas trained to deliver these programs as well. So they can receive training to offer either the Walk with Ease, Active Living Everyday, or Fit and Strong program. And we're offering about 220 instructor training grants this year, and the applications are due Monday, November 19th. So if you want to, disseminate this information to your networks, you feel free to reach out to me or the Osteoarthritis Action Alliance. They have this information as well. And the second grant opportunity is really related to or goal around those referral models. So this is essentially a second round of our referral pilot. We're referring to this as a community integrated health demonstration project. And we're going to be looking for 3 sites to, really pilot and look at how effective this EHR query is in different community settings. And those applications are going to be accepted until November 16th. So again, if you know of an agency or a partner who this might be of interest to, reach out to me or the Osteoarthritis Action Alliance for further information. And this brings me to the end of my presentation. I will now open up for questions. My email address is on here, as well as the website address where we have these grant opportunities available. You can browse some of our resources that we have available, including the best practices guide, success stories from agencies across the country as well. Haley?
Thank you, Lesha, for your presentation. So anyone, if you just have a question, you can just type it in the bottom chat box. And it looks like we have one question already. Is it possible to get a list of the Parks and Recreation AAEBI delivery partners? And can that information be broken down by state?
Yes, that's possible. Right now on our website, we have what we're referring to as an interactive map. So if you're interested in a particular state, you can click on the little dots that you see and then see exactly the agency and then can go to their website. And that's on our webpage as well, that interactive map. Perhaps early next year, we'll have a PDF of the list of all of the agencies by state, but right now the interactive map on our website does that as well.
Well, thank you for answering that question, Lesha. I do have one question. So, like you said, at the Osteoarthritis Action Alliance, we do have the Walk with Ease mini grant program, and I wanted to know, since you all offer um, two additional programs, have you what program have you had the most success with, and what program do participants seem to like the best?
Great question. And so to date, the Walk with Ease is the most popular program. And the feedback that we get is besides the fact that it's 3 times per week for 6 weeks, folks really like the fact that it's easy to implement. It's health education plus walking. A lot of folks, really just want to get into walking as a first step. And so that has been our most popular program to date, followed by Fit and Strong and Active Living Every Day.
Okay, thank you for answering that. That's good. I had a feeling it was Walk with Ease, but I just wanted to see what it was from your point
Yeah,
of view.
it's very popular. I want to say a little over 50% or so of our agencies actually, well, more than that, probably close to 60 or 65 actually implement the Walk with Ease program.
Oh, wow, that's good. So we have another question in the chat box. It says, "Great presentation, Lesha. Participant recruitment can be a challenge among local agencies delivering evidence-based programs, especially those without the strong infrastructure that NRPA provides. Can you speak to some of the lessons learned or strategies for successful participant recruitment at local parks and rec sites?"
Yeah, absolutely. And, we understand because we're working with a lot of different agencies. As you see, we have over 200 delivery partners, and not all of them have, the infrastructure, especially in rural areas where, there can be they're not well connected in the community as far as organizations coming together to make sure that everyone knows and is aware of what's happening. There are transportation issues and different things like that. So I'm going to speak a little bit to what some of the rural agencies have been doing so that they can recruit and then retain participants. One thing that we've heard, and this came through a few months ago, was that folks were including information about their programs in the utility bills, just because that gets out to, a lot of people everybody pays their utility bill. So it was a really great way to get out the information to a lot of people. And that's even partnership with, another sort of business in the community. And so that has really worked. Before agencies tried that, they had no participants signing up for the programs. Folks weren't really aware of the program. But one agency in particular, as soon as this went out in the utility bill, they had 20 people call and sign up for the program, and they took that as a success. They tried the program perhaps, I think, 3 times before they actually tried the utility bills. And so they're going to continue using that. But then a lot of agencies have started knocking on the community businesses' doors and really telling them about the program so they understand, especially their healthcare providers. So folks are aware that these programs exist. They know where to send individuals. And as it relates to transportation issues, some agencies have gotten sort of creative with their partners in terms of ride sharing, tapping into local transport, so that folks can, get transportation to a park and recreation setting. And in some situations or in some areas where, for example, medical transport can't transport to a park and recreation site, but it can transport to the healthcare provider site, they're looking into how they can go to the participants versus the participants come to them. So those are some of the ways that, especially in rural areas, that they're really looking to go outside of their settings and look to the community and look at those resources and those assets that they can use to recruit and retain the participants.
Well, thank you for answering our questions today, Lesha, and want to thank everyone for joining us today. And so you all can tune into our chat next month on November the 14th with Marie Westby and Cheryl Cohen on equipping OA patients and healthcare providers through patient engagement and research. And also, we welcome your feedback. So before you all go, please take a minute to complete our evaluation that will pop up on the screen shortly. And we thank you again, Lesha.
Thank you so much, Haley.
Thank
Bye.
you. Bye.